So we have a question from Brian Buckley about the student health insurance plan, noting that it is a self-insured account. And so wondering if we can provide insight on how to structure a student health plan in a way that does not put more cost on all students. I can speak to this a little from my perspective at the public health school. This is a really interesting question, and this issue of self-insured plans and different requirements they have under the law, different obligations to their members, is one that's come up a lot in bargaining sessions. I think, first of all, I'll note that a lot of other universities do have student health plans that are much more comprehensive, that don't have things like a cap on the number of specialist visits that a student can use, that don't have a cap on the number of mental health visits that are covered under the plan, that provide much more significant financial protection against those worst case scenarios. And that's true even in Boston. MIT grad workers, BU grad workers, I've looked at their plans, and they are much more robust to some of those issues and do not cost student workers anymore. Many schools also have much cheaper offerings for dependent insurance, and that's a particularly big issue, again, highlighting disparities and issues that student workers with families face. So there, in the sense of the university and the cost of the plan, waiving those limits on the most high need cases actually doesn't cost the university all that much because it's not used by that many students, but it provides an enormous amount of financial protection to those people who need it. And so it's a question of who can really bear this risk. And I think it's clear that the university, with tens of billions of dollars in their endowment, can bear the risk a lot more easily than an individual student worker and their family. And then there are some more complex insurance options, reinsurance and things like that, that I don't want to spend too long on this, but there are ways for the university to put more money into the plan so that they do not have to raise premiums on students across the board. They can choose essentially how much money to pay into the plan to support student workers. And if this is, if they really believe that health is a human right, as it says on posters all throughout the School of Public Health, then this is a very simple thing that the university can do to actually live up to that promise.